Hello, I'm Dominic Walker, JMW's Inside Man. My guest is Angharad Hughes. Angharad is a partner within JMW's Clinical Negligence department. Angharad, this month, April, it is Bowel Cancer Awareness Month. It's the fourth most common cancer. What are the signs that people should be aware of?
Yeah, it is. It is this month, and it's a cancer that affects the colon and the rectum. And there's a few signs that can seem quite innocuous and can be linked to other things. So don't never. It's always really important for people not to panic, but just keep an eye on these signs. So they're quite personal things. So it's things like some blood when you do a poo, or when you some bleeding around the bottom area. Any changes in bowel habits. So if you feel a bit different and there's no reason for that. Any weight loss, really sudden or unexplained weight loss, you're not trying to lose weight, you're not having a health kick, or any real extreme pain around your tummy, any lumps and bumps and things to be aware of. So they're just really important to keep an eye of. If you can keep a diary of those symptoms, and keep a track on when they're changing different days, it's a really good idea.
And I was staggered to read that every 15 minutes somebody is diagnosed. Is it important that, well, you're here and during April we raise this awareness?
It really is. I think it ties into what we were just talking about. These are really personal, sensitive symptoms that we don't like talking about. None of us like talking about. And it's really important that we're aware of those symptoms. There are a huge number of people that are diagnosed every year. It's over 40,000 based on Bowel Cancer UK's statistics. But like I say, it's an eminently treatable condition, and it's so important that people catch it early. They don't ignore these symptoms. If they're concerned about them, they get to the GP, because the chance of a good outcome and being able to be treated really increases as if you can get an early diagnosis.
And the work that you do, of course, is around delayed diagnosis in cancers. How can you help individuals if that unfortunately has happened in their case?
Of course, yeah, like you say, sadly, if it has been missed despite someone's best efforts to get that advice, and there's been an oversight or failing by a medical team, do get in touch with us. We've got a wealth of experience in dealing with this type of cancer and other cases, and can really help investigate a case and see if there's been a delay and see if it's changed that person's outcome, because it can have a huge impact on their life and that of their families and their day-to-day life that they may not be able to get back to. But again, key message is early diagnosis. Get to your GP.
Angharad, thank you very much. And if you'd like to speak to Angharad, you can email insideman@jmw.co.uk or call 0161 82 81 999. I'm Dominic Walker, JMW's Inside Man.